Welcome to another edition of Doc Talk. I'm Dr. Harish from Sukino, heading the Clinical and Quality Services. Today we have an eminent geriatrician, Dr. Steve Paul, with us, who's currently serving as the Senior Consultant and Associate Professor in the Department of Geriatrics, Apollo Hospitals Educational and Research Foundation, Apollo Hospitals, Banargata Road. He's also involved and trained with Queen Elizabeth Hospital, Adelaide, South Australia. He's a recipient of the Double Helical National Health Award 2019 for his distinguished contribution towards the geriatric care. He's an executive committee member at Indian Academy of Geriatricians, a faculty and a part of the expert panel with Public Health Foundation of India and Dementia India Alliance. He's also author of a couple of wonderful books by the name The Valence of Silver and The Patient Who Doctored Me. Welcome, Dr. Steve. Nice meeting you.
Thank you.
Thank you. So could you share some of your insights on how you would manage some of the common health challenges faced by seniors?
So older people are a complex variety. They have multiple issues regarding health challenges, social challenges, mental challenges. The common diseases such as diabetes, hypertension, strokes are more common in this population age group. So there is a lot of resistance to seeking treatment in older people. That's one of the common challenges we face.
How does social interaction and engagement positively impact the mental and emotional health of elderly?
This is probably the biggest pandemic now, loneliness. That's the biggest pandemic. And we all have seen what happens when people are lonely. The COVID pandemic was the best example of how our older people remained isolated at their homes. So social isolation and leads to depression, leads to poor quality of life, and leads to a lot of other mental related health problems that precipitate all other problems too. So which is why it is important to remain socially connected, and because social connection leads to healthy aging.
What are the key considerations when it comes to providing personalized care for elderly individuals?
Key consideration to providing personalized care. See, every older person is different. Just as how we do not treat every child the same way, age is not a criteria to decide on the treatment plans for a patient. Every patient has individual needs. So depending on their needs is how we personalize the treatment care. It is important to inquire what the family wants, what the patient wants, and what are his needs, and accordingly tailor the treatment as per the needs.
Yeah. We have one of the questions from the viewers. How can families create a supportive and safe environment at home for their aged loved ones?
So as we age, our needs are more. So the risks of falls and complications are also higher. So if you are a child or a son or a daughter settled somewhere else and cannot be physically present to take care of your parents, what you need to know is the home safe for them to live? Do they have adequate social support? Do they have sufficient safety? Is a home safe enough so that they do not have complications such as fall? If a fall related complication occurs, who is there to reach out to? How soon can a medical help be arranged for? So in the Western countries, there is a home survey that is done, and the home is made safe for preventing falls. Such measures need to be taken, installing grab bars and preventing unnecessary high steps, so that the home is made safe to prevent fall and its complications.
Taking things further, how can technology be integrated into geriatric care to improve patient outcomes and enhance their quality of life?
With technological advancement occurring, this should be revolutionized, and this should be utilized for the care of older people. Now, most of the older people are familiar with WhatsApps and phones. So digital literacy is something we should exploit. The use of smartwatch goes a long way. The smartwatch can help detect your blood pressure, can help detect your pulse, and often this is a clue that something may not be right. Older patients are also used to now even Alexa in most houses. So these devices, they help keep them active too if you have someone to talk to, and they respond also as if somebody is there at home. There are now watches integrated or devices that are integrated with phones, So if there is an alert that needs to be given, automatic alerts can be given to the family or the nearest kin so that help is provided immediately.
Could you elaborate on the concept of rehabilitation for the geriatrics and why it is so important for them?
The core principle of geriatrics is to maintain functional independence. A person may be 75 or 78, but may be able to manage his activities of daily living by himself, in the sense he is able to walk and manage all his activities by himself. An infection or an acute event can put him in a hospitalized state for which he requires now assistance. So this is where the concept of rehabilitation comes in. Although the medical illness for which he is admitted has been resolved, the patient may not be able to walk as well as before. This is where rehabilitation becomes important. It's important to engage physiotherapists, occupational therapists, and even a speech therapist so that they gain their previous level of functioning. This concept of rehabilitation is vital for effective, healthy aging.
Do you suggest any tailor-made programs for the elderly for rehabilitation based on their individual needs?
So most patients, when discharged from hospitals, have not achieved their previous level of functioning. It is important to design exercise programs for them so that they are monitored closely and supervised. And this has to be followed up regularly by the treating physician so that they can be modified and titrated according to their needs. If this follow-up is lacking, often patients say, okay, we will do physiotherapy at home, and there is no follow-up to what would have happened or how much the patient participates. So that's when there is a abrupt end of care, and we need to focus on continuum of care.
We have another question from the audience. What are the signs that as a family member one can look for in an elder if they can benefit from rehabilitation services?
So again, it depends on the previous level of functioning. If you may have a 90-year-old grandmother who's barely able to walk up to the dining table and come back. So an acute event may put them a little lacking in their previous capacity. So as long as the patient is motivated and willing to participate in such events, this is the first sign that the patient may benefit from a rehabilitation.
What are the key factors to consider for long-term care for elderly people?
When it comes to long-term care for elderly people, long-term you're talking about a few years from now. So first and foremost is to plan what will be the scenario 5 years or 10 years from now. Do they have sufficient support 5 years, 10 years from now? Do you need to make arrangements for the same? And find a place where they will be safer, even if it's their own home. Create the necessary modifications that's required, or engage other support services that would be of benefit to them.
Could you share a success story or examples of elderly patients who have undergone successful rehabilitation?
So there have been multiple such stories. There were patients who have been admitted following a fall and not catered to in the initial few days. And then they would diagnose to have a pneumonia or a urinary infection. Once the medical problems were sorted, this patient had not been walking, and fortunately the family was willing to admit this patient to a rehabilitative facility. Yeah, the patient was admitted in one of your branches, Sukino, and even today I happen to see her, and she is now able to walk with a single support. When she was discharged on a catheter, that is a tube for draining her urine, and she required 2 people to hoist her. From that point, she has come to a stage where she is able to walk with a single support. And the most important factor here is the patient's willingness and the family's willingness to go all the way.
Good to know. Could you elaborate on the concept of palliative care in geriatrics and when it becomes important?
This is a very interesting question. So, many people confuse geriatrics with palliative care. People think geriatric care is equivalent to end of life, palliative, and symptomatic care. Often patients and even doctors too, even healthcare professionals ask me, so what do you do in geriatrics beside smooth talking and attending to their psychiatric needs? Geriatric care is complex. There are a lot of medical issues that need to be taken care of, but there comes a time as age advances that the focus is shifted to a palliative care, but it is not the same. So when the palliative needs need to be tailored as per the patient's condition. His age alone is not a criteria. It depends on the curability of the lesion, his previous functional status, and whether there's a terminal illness and what the patient wants. പലരുടെയും ധാരണ ജിറിയാട്രിക്സും പാലിയേറ്റീവ് കെയർ ഒന്നാണെന്നാണ്. പ്രത്യേകിച്ച് കേരളം പോലത്തെ ഒരു നാട്ടിൽ വേർ പാലിയേറ്റീവ് മെഡിസിൻ ഇസ് സോ സ്ട്രോങ്. എനി പഞ്ചായത്ത് ഹാസ് എ പാലിയേറ്റീവ് ടീം. അപ്പോൾ ദ ഫസ്റ്റ് പേഴ്സൺ ദേ ഗോ ടു ഇസ് എ പാലിയേറ്റീവ് നഴ്സ് ആൻഡ് ദേ ഓൺലി നോ ഹൗ ടു ട്രീറ്റ് ആൻഡ് കംഫർട്ട് ദ പേഷ്യൻറ്റ്. ഓഫൻ ദിസ് ഇസ് എ റോങ് തിങ്. അപ്പോൾ പാലിയേറ്റീവ് കെയറും ജിറിയാട്രിക്സും ഒന്നല്ല. അത് ട്രീറ്റ് ചെയ്യാനും ആ പേഷ്യൻ്റെ പഴയ അവസ്ഥയിലേക്ക് വരുത്താനും സാധിക്കുന്ന ഒരു സ്പെഷ്യാലിറ്റിയാണ് ജിറിയാട്രിക്സ്.
What challenges do caregivers typically face when caring for an individual who's elderly, and what kind of support they can anticipate?
In the Western world, caregivers are largely paid caregivers. They are formal caregivers, they have been trained in the specialty, and they have their necessary work times very well scheduled. In a country like India, where we are, family is always the caregiver, and we live in this generation called a sandwich generation, where we have to take care of our children, we have to take care of our parents. So the caregiver burden is huge, and these are the huge challenges. They have to juggle between their jobs, they have to juggle between children's education, father's needs, even mother-in-law's needs or father-in-law's needs too. So it's the huge burden that they face, and often there are very few centers they can seek help from, very few people they can seek help from, which is why the concept of respite homes are very important. So places and rehab centers and respite homes will go a long way in reducing the burden.
What advice would you give to family members who seek help to navigate end-of-life issues for their elderly loved ones?
This is something I needed to talk about. As age approaches, as they suffer from their terminal illness, as the family and the patient himself realizes that there's not much of time left, it is important to initiate discussions regarding advanced care plans. What would he or she want if there was a need to ventilate? What he or she wants if there was a need to perform dialysis as a life-saving measure? So these are serious discussions that at some point the children or maybe in the presence of a doctor need to initiate with the patient, so that there is a clear-cut clarity on what should be the next step should another hospitalization occur. Often what happens is at a point when they require ventilation or subsequent management to save his life, this may be a patient with advanced dementia or a terminal illness, and the family does not know what to do. So then they are forced to go in with the decision of intubation and ventilation, the effects and the outcome of which is sometimes very less, especially in this aged group. So they are faced with no choice but to go for this option, which they often regret later.
Yeah, before we end this session, I would like your views on your latest book, The Valence of Silver.
So that's a story. That's my story, how I entered into geriatric care. It's a story about my grandmother, and this was during my formative years. How as a physician I thought I knew everything, and as I was seeing a lot of older people, I thought this all comes under the purview of adult medicine. But it's only when you're dealing with day-to-day requirements of older people, and as I blended into the needs, I realized how geriatrics is a lot different from what I thought it was, and that helped me take a decision to move exclusively into geriatric practice. That's what the book is all about.
Thank you. It was wonderful hosting you, Dr. Steve. A pleasure.
Thank you.
Namaste. Thank you. Right.